Welcome to Patient Matters, where we dive deep into the world of plastic surgery. I'm your host, Dr. James Southwell Keeley. In this series, we will engage in candid conversations with patients, specialist doctors, nurses, and others who have shaped this journey. Together, we will explore the realities of plastic surgery, covering everything from safe practices and patient recovery stories to the latest techniques and the artistry behind the craft. We'll also discuss governing bodies, address botched and revision surgeries, as well as share simulated consultations, all aimed at guiding you through your own plastic surgery journey. With decades of experience, I'm proud to be a member of ASPS and the Royal Australasian College of Surgeons. I serve as a plastic surgeon at St Vincent's Hospital in Sydney. Join us as we unravel the complexities and beauty of plastic surgery, one episode at a time. And now for Q&A. The first question here is, do women really feel pressure in the workplace to use Botox or fillers? I feel that this is probably the truth, but it's not as simple as that. I don't think there's anyone in the workplace telling women that they need to pursue these rejuvenation procedures. Rather, I feel it's a pressure they feel from within. And undoubtedly, that's fed into by social media pressures, as well as pressures from peers and younger colleagues who are doing the same thing themselves. Historically, these sort of procedures were very hush-hush. No one really talked about them, but it's becoming a lot more open. And so with that openness and the more frank discussion that goes around that, there was almost certainly some subliminal, if not direct pressure that women in the workplace feel to have things like Botox and fillers. Question 2. What are the main reasons women undergo cosmetic procedures or have plastic surgery in the workplace? I think this is multifactorial, essentially. Speaking to patients, you get the feeling that there's a drive to do this from within, but also from home, sometimes from partners or friends, and also from the workplace. I don't think it's a simple linear equation either. I think the individual feels greater or lesser pressure from those different facets of their life. But in one way or another, they go to shape the decisions that they make. And peppering all of those decisions, of course, is the global reach of social media. And that influence cannot be denied. Question 3. What do I foresee could be the effects of a patient's changed appearance that may impact upon family, friends, or partners? This is a really interesting question, and I think I'll answer it in 2 ways. Firstly, if the procedure that's been performed has been done well, and all the patient factors have been taken into account, then essentially the patient doesn't change their appearance. They just look like a better version of themselves. And flowing on from that, the impact then is minimal, maybe if only positive. You look well rested, you look refreshed, that sort of thing. If, however, the work that's been done is of poor quality or it's been done in excess, then the patient's appearance changes. And then the impact of that changed appearance could have unforeseen consequences at home, with one's partner, one's children, or in the workplace. This episode was researched, produced and directed by Michael Hennessy. Filming, recording and post-production by Wombat. Photography and lighting by Franziska Rauenhoff. Hair and makeup by JJ Rauenhoff. If you are thinking about undergoing plastic surgery, please make sure to consult with a qualified plastic surgeon. You can listen to more Patient Matter episodes on YouTube or follow the links on the Dr. JSK website. Thank you again for tuning in. I'm your host, Dr. James Southwell Keeley.